that'll be in order. We have the Ways and Means Amendment pending which there's a number of amendments. We're going to start with amendment number 320, offered by the gentlelady from Hampshire, Franklin, and Worcester, Ms. Comerford.
Number 320 by Ms. Comerford, transform local and regional public health.
Chair recognizes the gentlelady from Hampshire, Franklin, and Worcester.
Thank you, Mr. President, and through you to the members. I rise in support of this amendment and also in support of this legislation for local public health. When COVID hit, it was like an earthquake. This from Bill Murray, Director of Public Health in Sudbury. Quote, tremors were the first few cases. The eruption came within senior living facilities. Clusters and deaths attacking our most marginalized populations, requiring our nurses to work through weeks, health officials navigating changing quarantine protocols and overwhelming workloads to the point of exhaustion, end quote. And that earthquake manifested inequitably, tearing through the Commonwealth, exposing grave and cavernous racial inequities. Disproportionately, more people of color became infected, more suffered more severe illnesses, more were hospitalized, and tragically, more died. Dr. Craig Andrade, Board of Health member in the City of Brockton and Associate Dean of the Boston University School of Public Health, reflected, quote, when a community is overwhelmed with cases and staff are not able to quickly implement contact tracing, provide education, and recommend isolation and quarantine, more people get sick and more people die. And because we currently fund local public health entirely at the municipal level, more of those avoidable illnesses and deaths occur in low-income communities, often communities of color. I'll say this again for Dr. Andrade, quote, more of those avoidable illnesses and deaths occur in low-income communities, often communities of color. Damone Chaplin, health director in the City of New Bedford, brought this home in concrete terms. When the pandemic began, quote, New Bedford Health Department had approximately 65 fewer staff than health departments within cities of similar populations and sizes across the nation, end quote. As much as the fight for local public health funding and infrastructure is an acute, imperative racial justice fight, we must also acknowledge that this is also a small-town rural fight. Fran Fortino, Board of Health Chair in the town of Whately, told me, quote, we operate on a budget of under $3,000. This amount allows us to barely address basic responsibilities of housing, food, and septic inspections, and little else. At the beginning of the pandemic, we had no public health nursing available to handle COVID cases, investigations, or contact tracing. This reality, Mr. President, was echoed throughout the 4 Western counties, on the Cape and the Islands, and in rural pockets across the Commonwealth. Quote, I was surprised at how little infrastructure for public health exists at the local level. Health department staff did an amazing job from finding housing for people experiencing homelessness to quickly developing regulations to contain and manage the coronavirus. Their efforts were truly heroic, said Jeff Harness from Cooley Dickinson, a hospital serving a disproportionately rural region. But Jeff asks, should our system really be designed such that we have to hope that people are willing and able to work 70-hour weeks for weeks on end with limited support and guidance? Today, the Senate answers Jeff's question with a resounding no. Today, the Senate is rejecting a deadly and inequitable status quo with a bold investment of $250 million and the passage of policy designed to transform our system of public health into a 21st century system that Commonwealth residents need and deserve. Today, Tess Curran, Director of Health and Human Services in the City of Fall River, feels heard by our Chair of Ways and Means, himself a public health champion. Tess gave birth for the first time in early April 2020. 2 days later, Mr. President, she returned to work amid life and death stakes to help her people because there was no one else. Today, Jody Sugarman-Brazen, representing the Massachusetts Coalition of Occupational Safety and Health, feels seen. Jody said, quote, boards of health were given the primary responsibility for enforcement of COVID regulations. They were given this huge responsibility for keeping workers safe from a deadly airborne virus without any additional resources or even any input at the beginning into the content of regulations or standards. Today, Jody feels seen by our Senate President, who has led our Senate to address Jody's wrenching testimony head-on and address her calls for help. Today, Phoebe Walker from the Franklin Regional Council of Governments is cheering for the gentle lady from Arlington and the gentleman from the Cape and the Islands and Winchester, who are leaders in this body in this work. Our colleagues knew that before the pandemic, to quote Phoebe, local public health was responsible for ensuring that our neighbors, especially seniors, especially those living in poverty, were not exposed to rodents, mold, lack of heat, lead paint, or other hazards in their homes. They could not stop that crucial work even as they faced the crushing workload of responding to COVID. Local health staff in our communities put their neighbors' needs first and juggled an array of tasks through sheer force of will under impossible circumstances. Impossible circumstances understood by our Senate and addressed in this important legislation. Here's what the proposed $250 million investment will make possible. It will invest in three major areas, tackling agonizing structural deficits. First, direct aid concentrated in communities with the least ability to meet minimum public health standards, emphasizing increased cross-jurisdictional sharing agreements, staff capacity, and physical infrastructure. Second, workforce development, education, and training. This is the first step in ensuring a workforce capable of dealing with today's public health challenges. Skills taught will focus on communicable disease control, chronic disease prevention and control, environmental public health, maternal, child, and family health, food safety and inspections, and hazardous and toxic substances, and so much more. And third, because you cannot measure and address what you cannot see, this funding will enhance public health data systems. Currently, our Commonwealth doesn't have any one system to collect local public health data. We're saying no more to that as well in this legislation. This funding will not just purchase the data system, but it will get our entire Commonwealth, that's right, 351 health jurisdictions up to speed and able to use it effectively. Finally, today, Mr. President, via amendment number 320, which is in question before this body, the Senate delivers a policy framework to maximize the allocation and use of these critical funds. Tied directly to the recommendations of the bipartisan, bicameral, Special Commission on Local and Regional Public Health, the proposal before us sets statewide standards for the very first time and acknowledges the need for future state investment to ensure that everyone has access to a core set of public health protections. A person's zip code will no longer solely determine their public health protections. That is what the Senate is saying today. We didn't have these standard protections in place, and our public health foundation was woefully fragile when COVID hit our Massachusetts shores. And we were the worse for it, Mr. President. This bill says that the Commonwealth will be ready next time to educate, enforce, test, trace, quarantine, monitor, vaccinate, all equitably rooted and supported in local communities as it should be. Again, this is the product of the Special Commission on Local and Regional Public Health. It's a report, Mr. President, delivered to this body, a report held as central in the partnership I gladly share with two extraordinary House colleagues, Representatives Denise Garlick and Hannah Kane. Their efforts with me on this legislation, which is the totality of the pending amendment, their bold budget advocacy is present in the chamber as I speak to you. Their leadership is paramount. as is the stellar organizing and advocacy of the Massachusetts Public Health Association, as is the frontline service of Secretary Mary Lou Sutters and the teams at DPH and HHS, as are the public health officials in 351 cities and towns who wake up every morning with one goal, largely unseen by any of us, but as necessary as the air we breathe, the water we drink, the food we eat, to make us well and keep us well. And finally, we must lift up the work of the Joint Committee on Public Health in today's triumph, co-chaired ably by Representative Marjorie Decker, powered by her great committee staff. And I'd like to also thank my staff, Brian, Sam, Elena, Cameron, and Jared. They are tenacious, remarkable humans. They all helped make today's historic work happen. Please let me also extend thanks to the teams at Senate Ways and Means, the Senate President's Office, for these provisions and all the good represented in this bill before us. At the beginning of this session, Mr. President, I joined with Representative Liz Miranda to invite the prophetic Dr. Sandro Gallia to brief the legislature on how best to deliver an equitable response to the next pandemic, the next contagion. Dr. Gallia laid down a gauntlet, saying that if we were not serious in responding to the gross inequities we experienced during COVID, we should simply just write the next chapter and put it on a shelf. Dr. Gallia, thank you for this challenge. I am proud to say that today's financial investment in local and regional public health, coupled with a well-crafted, strategic, necessary, well-vetted policy framework, is the stuff of a bold and new equitable chapter. I respectfully ask for my colleagues' support, and I ask when a vote on amendment number 320 is taken, it is taken by a call of the yeas and the nays. Thank you, Mr. President.
May I call the yeas and nays? Those joining with her, please